Dayuwak, Hun Dayuguk, Gunashish to Kaduhan. Thank you, everybody. Gout, Kautahit, Gout, Kautahit. It is that time. It is that time where we go off agenda. Everyone always looks at me. Jesse knows better now. Where you guys are going to thank me later for this, or you're not. But either way, you're welcome. So, since we had a great big meal, I'm going to ask everybody to Gidahan, stand up. Gidahan, stand up. Come on. You're not going to be here at Health and Wellness if you're not going to burn some calories, all right? So, for those of you who have children in your lives, or want children in your lives, or around children, you're going to notice the one thing is there's a song that is very commonly used out in the world, and once again, I'm going to point out how English does everything incorrectly. They say, head, shoulders, knees, and toes. But in traditional languages, heads, shoulders, knees, and toes, they have to belong to somebody. Okay? So in this case, we're going to touch ourselves, not other people. So the word is going to be ach. Can everybody say ach? As long as you say that, we can get the rest wrong. But as long as you're saying my head, my shoulders, my knees, my toes. You guys know where this is going, I hope. My eyes, my ears, my mouth, my nose. Okay? So I'm going to sing this song for you guys. You're lucky you don't have to sing because I know you don't know it in my language. So this is to get the body moving before I call up the MCs to let us know what we're going to be doing and where we're going. Okay? So be ready, you two. So here we go. I'm just going to tell you what it is once, okay? And you just touch it. Achsha. Achik. Achki. Achkos. And for those of you who can't reach your toes, just point. Achwak. Achkuk. Achke. Achlu. All right, I'm going to ask you. Yinge yiwane. Are all of you ready? And you're going to answer in either Tlingit or Tagish, okay? In Tlingit, you say, ah. All right? It's like the beginning of that song. Can you guys do it again? Ah. Freak out. You know what song I'm talking about? All right. And then in Tagish, it's also the same as some of the other Dene languages. We have nasal tone and we go, eh. All right. Yinge yuane. Eh. Okay. All right. Here we go. Ready? I'm making sure most of us are doing it, especially the loud nursing station. Here we go. Ach shachik ach kiakos ach kiakos ach kiakos ach shachik ach kiakos ach wak ach cook ach ke ach flu. Good job. All right, here we go. I said we're gonna burn calories. We're not. That one was just warm up. So how we say faster in Tlingit is tlauk day. All right. This is what I do at the daycares every morning. Here we go. Tlauk day. Okay, everybody. All right. Jedrick Taylor, let us know where we're going and what we're doing, okay?
Awesome. Thank you. Okay. Ladies and gentlemen, everybody. Okay, so we are going off to our next breakout circles. There will be one here. Mine, personally. One sec. Actually, you know what? Take over.
Alrighty. So just a reminder that afternoon break does start at 3:10. So if you're skipping some sessions or going to some other, just come back here 3:10 for a yummy snack. For me, I'll again be in class 2. Feel free to follow me there and hang out. We'll have Together We Speak, a lived experience focused podcast. We'll have vitamin D and neurological health impacts across the lifespan, promoting youth wellness, understanding the impacts of programming in Pelly Crossing, as well as supporting Indigenous access to care in Dawson City. And that will be followed by the afternoon break. So feel free to come hang out with me or come hang out with my friends.
Perfect. Okay, so if you all follow me, you'll be joining me in a documentary called Traveling the Red Road, featuring Elder Ernie Lenny. There will be popcorn available from Klondike Kettle Corn. Come help yourself. There's a bunch of flavors. And yeah, this is a documentary following the life story of Ernie Lenny. And the story comes to life through interviews led by Jared Novolagak, weaving together intergenerational knowledge and inspiration. After the screening, we're honored to have Elder Ernie join us for a Q&A session, along with Malcolm Wilson, youth cinematographer behind the film, and Robin Manel, who served as a student mentor throughout the journey as well. So follow me if you want to see a movie and popcorn. Yes. Okay, we're going to start our way down to the breakout rooms right now. The documentary is down in the glass classroom, and
all my stuff's in classroom too. Come follow me. And then if you don't want to hang out with me or Jed, you're welcome to hang out with Gary here in the caf. Awesome. We'll see you all at 3:10.
Goodness, sheesh. Wow, I feel special. Looks like you all want to hang out with me. Jedrick, please bring me back something caramel popcornish. All right. I'm going to now introduce our presenters. First off, we have Stephanie Coombes. Stephanie Coombes is the nurse and program coordinator at the Youth Outreach Clinic. This role combines her interest in low-barrier healthcare and the health rights of youth with integrated health systems, frontline innovation, and decolonizing healthcare practices. Stephanie has been a registered nurse for 12 years and has worked in a variety of rural and remote northern locations. Prior to working with the Youth Outreach Clinic, she spent 3 years at the Kwanlin Dunn Health Center, where she led the development of an HPV vaccine campaign in conjunction with artist Stormy Bradley. Stephanie is a trained sexual health educator and a forensic nurse examiner. She holds a Bachelor of Environmental Studies and a Bachelor of Nursing from Memorial University of Newfoundland and Labrador, and a Master of Public Health from the University of Sydney. Stephanie is grateful to live on the traditional territory of the Taonquitchin, where she can be found skiing and biking with her family. Next, we also have Amy Smith, and she is a manager of counseling services, Whitehorse Mental Wellness and Substance Use Services, Yukon Government. Amy is very grateful to have been raised on the traditional land of the Kwanlin Dunn First Nation, the Carcross Tagish First Nation, and is of predominantly Scottish and Irish ancestry. She is a daughter, sister, mother, and auntie within her family and community. Amy currently works with the Child, Youth, and Family team as a manager. Amy holds a Bachelor of Kinesiology from Acadia University, a Master of Social Work and Master of Science with a specialization in adventure therapy from the University of New Hampshire, and is registered clinical social worker. She is humbled to be working with the cross-section of disciplines and people of diverse life experiences within her current role, and looks forward to building upon integrated youth services and family care within our community. Prior to being a counselor, Amy has worked with children and youth in a diversity of settings across the globe with a focus of experiential and land-based experiences. So let's put our hands together and welcome our speakers.
Ganashish, Gary? Is this on? Yeah? Ganashish? I didn't know that was going to be read out loud. Just to do a really brief synopsis of that, I also realized I missed my pronouns, so my pronouns are she, her. And just wanted to express the gratitude for being all together on the lands today of the Kwanlin Dunn First Nation and the Taonquitchin peoples.
Yeah, thanks, Amy. Yeah, I'm Stephanie Waishide. I'm the nurse. We're just going to go over today a new project that was started in Whitehorse, so a youth clinic that opened a few months ago, and how that kind of fits within the branch of government that we're at and with community partners. They had asked us, when I asked what they wanted us to speak about, the direction I got was speak about what you're passionate about, which is, with me and Amy, it's like a lot. But what we're going to do today is kind of give an overview of the functioning of the clinic, how it's integrated into the community, some preliminary data that we've started been collecting, and some sort of lessons moving forward. We really want to hear from the community. So if there's partners in the group that we haven't connected to yet, and you think this could be a good fit with your organization or communities, please reach out after. We'll try to move through it all, and we'd love to have questions after as well. So. Okay.
Thanks, Steph. So just walking you through the core elements of what exists currently. We have the mental health supports within our child, youth, and family team. And then Stephanie will touch on the clinical care, and we'll go through how we are engaging in youth participation, and as well as community partners. So I'll start us off with the mental health piece. So the supports that have existed for some time are mental health supports for the children, youth, and families in all of Yukon, but we are predominantly focused on Whitehorse as we talk about today. I just wanted to name that. It's a team of counselors, youth engagement workers, now a nurse, and they're providing one-on-one counseling, group counseling, family counseling, outreach work, so counselors going to schools, any kind of organizational outreach work, really. Yeah. Yeah. Yes. So this is a photo of our team. And yeah, this is the foundation of what exists. And the whole concept of moving towards the integration of care is not creating something that's brand new. It's reorganizing our existing care. So I just want to take a pause and invite everyone to bring your hand in the air. Thank you for playing along. And I just want you to take your finger and circle it clockwise. Take a look at it and make sure your finger is going around clockwise. And then I'm slowly going to and you'll slowly bring your finger down, 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 down. And now I just want you to check out which way is your finger going. Gary, be the voice. What do you notice?
I went the wrong way after we're out.
Did you go the wrong way? Okay.
I started right way.
Right. So at the beginning, people would have been going clockwise. Which way were you going at the bottom? Right. And you didn't change direction. What was it? Perspective. Yeah, the way we're looking at it, right? And that's what we're really challenging ourselves to do in conjunction and collaboration with the community, is really change our perspective of how we're looking at care, how we're integrating together, how we're bringing that collaboration piece into action. So separating from those silos that we kind of consistently hear of, and stepping into more, bringing the humans to the system and integrating as a new system.
Specific to the clinical care that we're providing, the position was suggested that a registered nurse would be good to have on the team, because some of the counselors working with these children and youth were noticing sometimes youth had questions that might be good for a nurse, like, I think that I'm pregnant, or they're struggling with their mental health, or they have lots of stresses that might need a little bit of a medical lens. And I can't believe they gave me this job. But somehow I get to go and work with youth all day in this primary care way. It's been really great so far. So just like a quick summary, essentially I have a clinical office, just like a regular medical facility in where the counselors are. So that means if a youth's in with a counselor, say they need blood work for an eating disorder, they can pop over and just see me right away and get their blood work drawn. Or they might just need to check in with something, or they have a question or whatever. And then so that's sort of the clinical space, but we also extend the supports to any youth at all, any youth between the age of 12 and 18. They don't have to be connected to a counselor. They can come in on their own. Youth can make appointments by texting, which has been great. They can call as well. Then they're often referred to from other healthcare providers. We have some drop-in appointment times, which is really important, and we have evening clinical times, like after-school hours no teenager is going to come in at 9 anyway, but having that after-school hours is really important. And so, yeah, after school, that's been good. And then the other piece we do is a lot of outreach clinical services. So I was able to buy like a really sweet Milwaukee toolkit. I pack up the whole clinic, and I can launch a clinic in any site. And that's been really successful so far. So we have been providing that in a couple different locations, and that's been really successful. And I think a lot of the sort of goals of the clinic are in line with that, putting people first, more collaboration, breaking down barriers, making it easier for youth to access care. So they can come and see me. Generally, it's what we call non-urgent primary care. So anything within a registered nurse's scope, we do vaccines, we do blood work, we do general health assessments, we do health education. I do a lot of like, you should see this person. Nope, this is how you go see this person. We're going to make that appointment with that doctor. But I'm really lucky. I want to shout out the Lynx Pediatric Clinic has been really supportive as well. And they've written what we call like a standing order in healthcare. So we have a bunch of stuff that I do in collaboration with them. So a youth can come and see me and leave with a prescription for birth control. And they don't need to like go and see a physician for that. And then the pediatricians are available to me on call. If someone comes in that I'm like, I don't know, we can just speak right away to a physician to help connect a youth to them as well. So that's kind of how the clinic is operating so far.
And then just to walk you through a bit of how we're currently engaging in youth and family participation, with the disclaimer that we are here presently invited by WISE4 because we're really working on that evaluation piece alongside them as well. So in the day-to-day work, there's the ongoing feedback collected from youth, families, and community partners and providers that we collaborate with and work with. In August, there was the formation of a youth advisory circle committee that consists of 7 youth from across the Yukon, and they meet every 2 months just to provide feedback and input on any youth-related services with mental wellness and substance use services. So they'll be arriving in town all together on the 18th to kind of do a tour of the services. And again, the concept with this is just to get that direct feedback and conceptualization from them. An example of that is we've worked on child surveys, youth surveys, and family surveys to be able to collect that feedback. And the Youth Advisory Committee reviewed them and provided their own feedback on the surveys themselves as well. And then another big, timely way that I feel grateful for is just the existence of the territorial youth strategy that the Youth Collective has worked on. And that is an easy invitation to have that youth-informed conversation as well. So they'll be expanding on that, but yeah.
And then the other piece we really want to highlight is so far, like a lot of support and involvement from all community partners. Like the first 2 months, I kind of just cold called anyone I didn't know or walked into the offices I did know. We really wanted to reach out to major community players and ask like the frontline people working with youth, the youth themselves, like what services do you want to see? What do you think, like what is going to be the most benefit? How do we focus our time? How should we run the clinic? And it's really nice to have such positive feedback. I don't get that a lot as a nurse. Like sometimes it's like not the easiest atmosphere to make change, and having this really excited feeling from the community was great. So, I mean, there's a lot of people that we could list, like within the Yukon Government, that includes health promotion, that includes YCDC, the Department of Ed, the principals and superintendents. How can we bring this to the schools? And then within the medical community, the family doctor's offices, the Yukon Sexual Health Clinic, a lot of the specialists as well, the Opal Clinic for terminations. We've been connected to like the incredible list of NGOs who do so much of the heavy work in the medical community here. So we've got Blood Ties, we've got BITE, we've got Queer Yukon, and there's so many. And then especially within the First Nations department, so we were able to connect with CYFN, YFNED, and the First Nations School Board, Kwanlin Dun and their Wellness Center as well. And really just being like, please guide us as we create this service. What does the community want, and how can we reflect the need of the community? So yeah, it was really fun getting to meet everybody. But
so just to touch on what we're striving towards or what we aim to be.
Yeah, when we look at as we establish this surface, what are sort of our frameworks? One of the main goals is the term youth friendly. Meaning that youth feel safe and welcome and they want to come and participate in these services, and that they have a voice in how these services are created. Youth-friendly is very similar to the concept of culturally safe care, which we also really strive to provide. And as a white nurse, I can't deem my practice culturally safe. That comes from the patient's experience. And so similarly, I can't say, stamp, this is a youth-friendly clinic. We need youth to help us get there. We're really new, so we're really welcoming feedback from youth themselves through surveys, through engagement. There are a lot of really great vetted tools for the establishment of youth-friendly clinical services that we could, bring in a little bit. So how do we lay out the space? What kind of art do we choose? Do we have drop-in times? Is there free wireless in the waiting room? Is it confidential? Are there snacks? Really things that might seem obvious, but essentially we want to create a judgment-free, a confidential space that youth want to engage with. The second piece is something that's low barrier. So low barrier healthcare means that we're trying to remove some of those obstacles that might make it harder for youth, so here 12 to 18, to engage in those services. Some of the things we've tried to put in so far is just texting, so that youth can text me for a service, which is nonstop, which is really wonderful to see. And then they can call too, but no one does. So texting was a really great one. We wanted after-hours services. We wanted drop-in capabilities. We wanted it to be very easy for youth to come in. I'll talk about this in a bit. In reality, it's still really messy, but from the youth's perspective, they can come in and see me, ask for birth control, and leave with that prescription, or at least a sample of it as well. So we sort of wanted them to come in and receive a tangible service and left having their needs be met or acknowledged in a good way. So that's sort of the idea behind a low barrier clinic.
Yeah, and then the third priority or focus is bringing that integration. The integration of decision making, integrating the voices of youth and the families that we're working with, integrating the cross-sectional, across departments, across cultures, across services, integrating that collaborative voice. Yeah.
Yeah, I think that's everything. And so we're here, this is WISPOR, obviously, yay for data, this is really great. We're brand new, so we don't have any data at all, but we're building on it. So we do have the support from the Health and Social Services policy analyst team, which has been incredible.
Thank you, Sandy Bowley.
Yeah, so essentially meaning, the joy of creating a new service, it's sort of renovating a house versus building a new one. We can think about from the beginning what services are provided and how do we evaluate them from the beginning of the program and build in the evaluation to the process of the clinic creation. So the last thing we want is that we've decided as 40-year-olds that this is the kind of youth clinic Whitehorse needs. So we need to have constant feedback from the community so that our services can reflect the current needs as they change. And so a few formal ways that we're doing that is the establishment of a logic model with indicators, outcomes, what are we measuring, how are we measuring them, how are we pulling that data? And we're still working on that, so we can't quite share that yet. But that's been actually quite fun to be okay, we want the clinic to increase access. Well, how do we measure that? How do we tell that if this is even increasing the access? So walking through that process has been incredible. And so I think, let me look at my notes. Yeah, and then WISPOR has been incredibly supportive of that as well. Right now we're pulling the data from a few different places to kind of gather that information so far. So that youth surveys that will be coming out, that will be feeding a lot of that actual engagement response. How did the services meet the needs of the youth? And then if we go to a bit more preliminary formal data, so one of the ones we're looking at, right now we're charting in a few different EMRs, so electronic medical records, so we're able to pull a little bit of information from that so far. So the first, technically open April 27th, the first 2 months was policy writing and community engagement. So that means that between April and as of October 24th, 69 individuals had accessed the services of the clinic. That data is a bit funny because many of those youth have come multiple times or might be coming weekly, but that's just the number of individuals who have engaged so far. And right now it feels personally I'm at the beginning of the very big exponential growth curve. So slow at the beginning. Now I'm getting every day 2 or 3 new youth are reaching out to the clinic to engage. So it's it's a little scary. So they're taking off. In terms of some other data that we can share today, just looking at the age of who is accessing those services. I don't have this stratified by gender. We don't have quite enough yet to do that privately. We do have a high number of trans youth that are accessing the service. So as of right now, we've kept it just by age. The clinic is advertised as 12 to 18. There's lots of discussions happening about how can we expand that to youth up to the age of 24. And so, but right now that peak age is sort of that later high school, 15, 16, 17 age.
Gosh, I was going to add something, but I got
Go. Yeah, okay. And right now, the key issues that youth are presenting with, so sexual and reproductive health, about 40%, mental health and substance use, and then other makes up general primary care, vaccines, and then a little bit of like health education as well. It's not quite enough there to privately split that up either. This is very similar to what we see at places like the Foundry in BC. Youth tend to access youth-friendly care for what we would call like sensitive topics. So sexual health, harm reduction, substance use, mental health. We welcome everything, all services are welcome, but that's what we would expect to be seeing.
So just taking a look at our takeaways, I think both Steph and I and our team really want to walk as humans within the community. So the biggest, or one of the takeaways or things are just building that community connection. So recognizing, when both Steph and I just joined the team within the last year, and it's easy to kind of categorize everything into those silos, right, that exist. But as we get to know everyone and are taking the time to build those relationships, that's where that synergy and that collaboration start to take place, and all the referrals kind of flow from there, because it's human to human. And so that's one of our biggest takeaway, is taking the time to build those relationships and know each other as humans. Anything to...
No, I think that makes sense. Yeah, and then a couple of things. Texting, big success. That's been great. Surprise, surprise. Youth want to text me. They don't want to call me. That's been fantastic. I'm even reminding them for appointments. People are coming in all the time. It's been really great. And then going to where the youth are. The youth panel up here mentioned that like missing school is a big issue. So we just got approval from the Department of Ed. We've been running a clinic out of the ILC school, which has been wonderful. And we've been approved to go in and do monthly clinics out of the high schools. So where youth can come in during the school day and come and see a nurse. Which is really great. Apparently it's like revolutionary to have a nurse in a school. Like I didn't know that was, like that faded away and now we're bringing it back. So that's been great. Just of note though, we do engage a lot with youth who are not engaging in the school system. So youth that have poor attendance or no attendance or not engaging in the school at all. We want to set up outreach capabilities to catch all youth, that all youth feel welcome. The administrative barriers that we're mentioning there is that, again, from the youth perspective, it looks real smooth. Behind the scenes, I'm charting in 4 places. Like, there's a lot of, those silos are all still there. We're just trying to eliminate some of those barriers for the youth, but the system itself is still very siloed. So that's my job. I do that.
And an example of that, what I was going to expand on with the youth, the age of the youth accessing services, we're really hoping to target that 18 to 24-year-old range too. And the administrative barriers, those systemic, like, how do we make that work the way it all exists? So that's where we're really trying to challenge ourselves to break down some of those pieces, make it possible. And then the measurement-based care, just tailoring, getting ongoing feedback directly from the people we're working with so that we can tailor things to that individual ongoingly. That's an area that we're really working towards improving as well. And moving forward, I think it's just building upon these relationships, hopefully inviting all of you who want to take part in this, working on how do we include all of these voices. Like, it's easy to say, it's really difficult to figure out all the nuance. Like, how do you reach the vulnerable youth to get their voices included in the decision making? That's kind of one of the directions. And then just that interdisciplinary, collaborative team care, being able to learn from each other and have that learning health system and integrate into everything. Did you want to add anything, Steph? So then from here, we're just open to questions, comments. Really want to invite anyone outside of this just to reach out if you see an opportunity to collaborate.
Are we late? Are we on? Okay.
We'll come to you next.
I just had a question about your feedback process for your clients, and then also how did you reach your youth advisory group. I can't recall what they were called, but how did you recruit those youth to work with you?
Thank you. We actually need to do a shout out to the BITE and the Territorial Youth Collective. So BITE assisted us. We did the recruitment, they advertised, they marketed it all, and then we sat together as a committee and went through all the applicants for that advisory committee. But we really did need their support in that process because we couldn't have done that internally. Thanks, Heidi.
I was just wondering for kids who are like, is this still confidential information if like a 13-year-old comes to you and is like, I want to go on birth control? Like how does that work?
Yes.
It is? Okay. Cool.
Longer than we picked the 12 age based on the age of consensual sexual activity in Canada, meaning a 12-year-old can consent to have sex with someone up to the age of 14. This is rare. This is just the way that the law is written. So we picked 12 so that a 12-year-old, in theory, could present for confidential sexual health education. We see children younger than 12. So often, like, I've been working a lot with the pediatricians to provide sort of like one-on-one for youth with any cognitive delay, so who might not need a little bit of extra time in their sexual health education, and working with parents through that sort of physical process. In the Yukon, under the mature minor legislation, it's up to like the clinician to decide if a youth is able to consent to any treatment. So nothing legal happens at 12 that they can come in. It's still my duty to ensure that the child is mature enough to make that decision, and it falls on my licensing to consider things like the duty to report and all that informed piece. But yeah.
Thank you.
Okay.
Here, so the microphones are for online people because I never need a mic.
I know it's still early. Obviously, I'm just curious, is there plans to grow for like more people to do what you're doing, or maybe in the community, or is this just like you're just starting and seeing where it goes and collecting information?
Amy, can I have a permanent job?
She paid me to be here.
Yeah, exactly. Yes, yeah. Right now, the position is very new, and I really want to like thank the manager. Actually, I've never had a position with so little micromanaging and so much professional support. It's wild in nursing. So it's been amazing to have this community input. Right now it's me, I'm in a term, it's a one nurse position, and I think it was like, how does this go? Like, how does this work? Yes, it's getting very busy very quickly. We would love to expand. With that community piece, right now, like we've just connected with the high schools. So if a community or like a First Nations wellness group reaches out and says, hey, we're having a youth night, could you come up to Ross River? Then yes, like absolutely. We can like foster those connections as kind of dictated by that community. So if a community identifies this might be a good fit with the project that they're running, then yes, we would figure out that collaboration.
And then just to expand on the concept of the integrated youth services, there is like that it's an actual sector developing within Canada for the last 20 years. We're a little behind, I guess. So there are hopefully opportunities to be building this more within community, and that's that invitation again, like who knows what that will look like, but Steph and I and the whole team really do want to communicate, like we want to be a part of that. Like what does that look like? Who knows? But that will be informed by the youth in our communities.
Thanks, Amy and Stephanie. Great job. Could you talk a bit more about your engagement with parents and how you navigate it if and when what a parent wants runs up against what a youth might want for themselves?
In the context of all care or primary care?
Yes.
Yes.
I think if it's anyone over 12 or 13, then it is youth-led. So a parent, grandparent, auntie might be really concerned about someone, and it's that youth has to lead that engagement piece. Does that make sense?
Yeah, and I think those are good questions. I think ultimately the goal of the clinic in reality, where it's one nurse is to provide easy access to healthcare for youth that might not have easy access to healthcare. So when I look at like how I spend my week, my goal is really youth who do not have an askable adult, who don't have someone that can sit with them in the ER for 8 hours to get that prescription for their sore ear, who might have faced like multiple levels of systemic racism in the emergency department. They need another place to find healthcare. So in reality, like, my goal is to help youth that actually don't have an adult that's helping them transition to adult care. Any youth is welcome to come in and see me. And we really welcome youth to bring families with them or bring people to come with them. Like, parents are welcome to call. We've chatted a lot with parents. Often, I actually get more of, can you put my daughter on birth control, please? And then I'm like, can you please leave the room? And do you want to go on birth control? Like, it's more of the opposite, actually, but we're really just trying to make another entry point into the healthcare system. We're being very transparent. There's no like the secret nurse is secretly doing things to my kid that I don't know about. It's really more, how do we capture those youth who actually just like need primary care and are not accessing it. So we work a lot with group homes, situations like that going to the high schools. But parents are super welcome to call anytime and be like, what does this look like? Yeah.
Okay, we have one last question, and since the people weren't eager to get questions, this is going to be the last question because we have more speakers to come up. So one last question.
I'll make it quick, but I was just curious, do you guys support youth that would say facing marginalization such as homelessness, not having like government ID? Do you guys support them in accessing like a medical card, insurance, that kind of thing? And then the second part was, is there any sort of referral service that a youth needs to access your services, or it is open to everybody just based on their age?
It is open to everybody. Anyone under, I don't know, like 13, the parents have to come for the child. For the youth clinic itself, then yeah, and it's just self-referral.
Do you support them like if they don't have an ID and they need medical
Right.
insurance, like getting an actual Yukon medical card?
Yeah, so Dale's asking, do we have anyone kind of to support the day-to-day tasks like getting a government ID or navigating the system? And we don't have a system navigator like that. That is on our goal. We definitely, I think as a community, that's been named as a need for sure.
But I think when youth present, say they have like a BC healthcare card, then I'll fill the form out for that. Like we'll figure that process out together. Often it's a lot of it is like advocacy to let youth know they have like the right to access healthcare, and that how they apply for a family doctor. This is who you call to get on the list for Constellation because you're aging out or you're a new immigrant to the country. How do we get you connected to a medical clinic? There's a certain amount of social work in the position that I'm happy to help with. But we don't like, within the Yukon, like we can run blood work on you whether you have a healthcare card or not. So it's prescription coverage gets a bit gray, but we can mostly figure that one out.
All right. Well, thank you to Amy and Stephanie. Goodness, sheesh.
Thank you, everyone.